Okay, let's go ahead and get going. Thank you both for joining us. Some others may hop in as we go, but we can go ahead and get started. And we'll go around and just do quick introductions of our leadership that is with us today. Commissioner Hedberg.
Yeah, hi Eric, it's good to see you. Heidi Hedberg, Commissioner for the Department of Health.
Hi, Eric. Emily Ricci, Deputy Commissioner with the Department of Health.
Hello, I'm Betsy Wood. I'm the Associate Director for the Office of Health Savings, also with the Department of Health.
I'm Dr. Ann Zink, practicing emergency physician and assisting the state.
Okay, so Eric, do you have any questions for these lovely ladies today?
I do, yeah. I submitted one through the link, and that was basically, can you give a few examples of, there are the 6 sort of area initiatives, I think is what they're called, for how the money will be used. Can you sort of talk concretely about what sort of things that you'd like to accomplish with the money?
Yeah, I mean, I could, I'll start off with, when we think of our current healthcare system and it's very fractured. We have this one-time generational funding, and we want to look at how to care for prenatal, ensuring that from the very beginning that mothers and babies and families have those early supports that they need early on. I would say under healthcare access, there's a lot of conversations around how to increase access so that elders have supports so they can stay in their home or their community longer before needing to move out of their home or into a skilled nursing facility, as an example. We hear a lot from the IDD population that they are looking for those additional supports, again, to stay in home or in community instead of moving out of their community for higher levels of care. So I think that this funding specifically, I could use the exact same around behavioral health. And there's a lot of work that we've done around behavioral health, from looking at I would say building off of the work that we've done through the Youth Behavioral Health Roadmap with increasing access, so school-based services. Kids are in school, teachers are focusing on teaching. How do we have those clinicians trained in primary care or behavioral health to be on location so that with parent permission, they can go and parent support, they have that additional service available to them. I think it's that connection with school-based services and supporting families and where kids are at in school. When I think for pay for value, I will definitely turn it over to Emily and she can give some examples of pay for value. But I think the other two, strengthening the workforce and with technology, we heard pretty loud and clear when we were engaging in getting ideas from Alaskans, what their needs were. And it was very much of building up the workforce, so having a lot more opportunities to enter through apprenticeships or certifications for the entry-level workforce in healthcare, in addition to residency programs for physicians. We have a really small, narrow focus right now. We want to expand that. So looking at the full spectrum, and that's a lot of that with workforces partnering with the university system. And so I think there's been some early conversations that we've had with the university system at all campuses and how we can partner together in that space. I think technology is advancing a lot. And so that's on Thursday and Friday, we're going to be unpacking more about how technology can really help patients, how technology can really help providers, so that patients have their information, that providers are spending more time caring for their patients and less time entering multiple times the information in their electronic health record, as an example. Or there's a lot of discussion around wearables and how that technology can be used to kind of help connect that patient and that provider together. I think we could go off of lots of different examples, but I think it's more important to hear at the community level, what are the needs in the community and the region? And this funding is really to support what the community and region need. And every community and every region needs something different. So that's why you see big guardrails around these 6 different initiatives. Emily, do you want to talk about the pay for value? And then, Anne, I'm sure you can talk more about technology and workforce.
Yeah, I'll give some examples of pay for value, but I really think about the concept of pay for value as kind of that end goal of how do we make sure that healthcare providers in Alaska are being reimbursed for the activities that they need to, and they are engaging in to keep our community healthy. And that doesn't always align with what how our reimbursement structure exists right now. So like when I step back and I think about the healthcare system and some of the challenges, right? It's confusing for patients. It's really hard to figure out where to go. It's hard to figure out sometimes to get the coordinated care you need. It's frustrating for providers because right now they're not always able to practice medicine. I think the way that they envisioned going into the field, there's a lot of bureaucratic barriers. There's a lot of administrative hoops, right? There's a lot of infrastructure around that exists that kind of takes away from that provider-patient experience. And then for payers, it's very expensive. We know this. This has been a problem for Alaska since I've been involved in the healthcare industry. And ultimately, it's very fragmented. So when I think about kind of that pay for value component, it really is, are there different ways that we can align how providers are reimbursed that create financial stability, particularly in some of our smaller, medium or smaller size communities where they might be really struggling right now, but they're absolutely critical to having healthcare access for Alaskan residents. But also, how can we promote and support through our reimbursement structure the services that we want to see, right? And primary care is an example where we know, regardless of kind of how we decide as a state, not just the state of Alaska, but like as a state, we want to shift our healthcare system. We know that primary care is the foundation of that. And so when we think about pay for value, it's really easy to say, oh, we're just going to pay for value. We're going to do value-based payment. The realities of making that transition takes time. It's very challenging, and it will look different for every community and every provider and the provider types. So how can we use this funding to begin now over the next 5 years, building out kind of the infrastructure, the concepts, the protocols, the data that providers need in order to kind of make that transition to a payment model that really reflects sustainability for them. So that's how I think about it. Again, what might work for a Seoul Community Hospital is going to be different than what we need to look at for primary care providers.
Yeah, and I guess I would just add, this is a remarkable opportunity from the federal government to address a longstanding challenge across the entire country. We consistently see that people who live in rural areas, Alaska and beyond, have worse health outcomes with increased cost. And this is an opportunity to rethink the way that care is delivered to make sure no matter where you live, you have access to quality, timely, effective care. I also think this is a unique opportunity for Alaska, not just to lead for Alaskans, but to lead for the country, because our rurality is not just our limitation, but in this place, it can be our asset in the way that we use telehealth, the way that we use services and connection together. We know that people do worse in rural care because of distance, because of delays, because of workforce shortage, because of fragility within the healthcare system, such as hospital system, because of the lack of number of people in the system, as well as the socioeconomic headwinds and infrastructure gaps. And really you saw with the CMS proposal and plan coming out, really being able to address this. I would highlight that this is not specific for a subgroup of Alaskans. This really fits all Alaskans, and this is an opportunity for us to reimagine the entire system within Alaska. And then regarding the workforce and technology, it's many times I, see a patient in the emergency department, and they say I'm on 2 white pills, and I have no idea what that looks like. Or they may have done a care plan of what they want for their end of life care, and I can't see that and honor their wishes. And so by using technology to create systems where we can really be at the patient's bedside and connected to them, that bedside may be their bed at home, or it may be in the emergency department where I happen to see them, but we're able to provide services where patients are at and have the infrastructure to do it. This is a real opportunity to move and to lead again the country in that space. I would also highlight that workforce in this country in general tends to be incredibly urbanized. People train in urban areas, they learn to practice in urban areas, and it becomes very hard to know how to work in rural areas. And that becomes a huge limitation for many people choosing to work in rural Alaska or in Alaska as a whole. And this is a real opportunity for us to support providers in the entire spectrum, be it an ultrasound technician to a community health worker to a community health aide to a cardiac subspecialist who needs to serve someone in Utvi-Advik to make sure that care is delivered for the whole person care no matter where they're at in the state.
Eric, I would just add to that Healthy Communities is really focused in on that prevention. And so what is prevention? What we know based off of our Medicaid claims is that 75% of Alaskans have one or more chronic diseases, right? So we're thinking hypertension, obesity, diabetes. So I think this generational opportunity is how do we get at the core, the root cause, and really help Alaskans being informed and making those healthy food choices, helping them with meaningful exercise, and shifting that healthcare system from really paying and treating the most acute really upstream, looking at how we can focus and pivot more towards prevention. And I think one of the outcomes is you have healthier Alaskans, right, who feel better. But then what will also, one of the desires is that the Medicaid program, we're really going to help bend that cost curve that we're seeing with our claims.
Yeah. Could I ask another question?
Yeah.
I have a few questions about sustainability. This is a 5-year program, $273 million a year. We saw a lot during COVID that governments overexpanded and then sort of had to figure out how to keep all of these programs running. There's also the question, we're in an election year. There is probably going to be some turnover in government. And I'm curious sort of how you guys are planning to sustain the progress that you're able to make with this program, beyond this year and then beyond, 5 years when the program ends.
Eric, that's a great question. And we've been talking a lot about sustainability. And so I think everyone should answer that question. I would say, we have spent a lot of time listening to just the different community organizations and social service organizations, hospitals and clinics. I would say that there's definitely a subset where they just need the startup funding that is one time only in order to really launch this project, right? And so I think that we have to recognize that that's been one of the biggest barriers is that they have lacked the funding to, metaphorically build out that project that they're intended to do. I would also say that there is this other element around sustainability. And if you think of all of the resources that go into healthcare, what we're going to start to see over the next 5 years is as you have cost savings in this area, you can use that cost savings to focus on this other area that you have built out. So I think that we're going to start to see some changes that will happen in that healthcare landscape. We have one initiative specifically focused on that pay for value. And I think Emily did a really good job kind of unpacking that. When we think about bringing healthcare and our social services organizations together so that they are integrated as they're taking care of the whole health of the person. That is that integration and the sharing and caring for that work of the whatever business line that could be. And I think that there can be cost savings that happen in that space. We also talk about the back office, all of that work that happens in that back office, right? How do you leverage technology using that RHTP as one-time funding to purchase that technology? And then you have to maintain it, which is cheaper, right? You also have cost savings when you're modernizing how you run your business. There's also a component, we've had a lot of philanthropic organizations say, we want to partner with you as we work together in the fundamental transformation of the healthcare system. And so I think there's been a lot of great positive conversations, understanding and asking the question, sustainability, is it startup? Is it one time? We also recognize that the Medicaid program is going to have to change as well, right? So, as with the funding is going out to communities and they're starting to change how they are working, we also, as the Department of Health, both need to make those systemic changes because some of this work will be appropriately carried on and reimbursed by, whether it's Medicare or Medicaid or one of the commercial insurance plans. So I think there's a lot of opportunities for sustainability. It's really supporting the applicants in developing those sustainability plans. But I'd be curious, Emily, Ann, Betsy, how would you guys answer that question?
Yeah, I think one of the things that we're acutely aware, there are two issues that we're acutely aware of, right? One is the sustainability. How do you make sure that we are actually leveraging this opportunity to create the next evolution of Alaska's healthcare system, right? Where we have the best rural healthcare system in the nation. And I think there's aspects of that in Alaska already. I would like to see those aspects expand. And how do we avoid what we experienced with COVID, where there was that cliff, right? So it's like, how do we move away from kind of bloating the current system we have in ways that aren't working, and how do we actually look at that evolution, doing things differently that result, and I think there is a lot of opportunity in healthcare to have better outcomes, better opportunities for providers to practice the way that they want to, and sustainable funding, right? So that's the evolution. To the other question that I think about and that we've been very acutely aware of is, how do you design a program that will span half a decade, which will span multiple election cycles, right? Multiple administrations, multiple staff changes. And so how do you create a structure that is resilient within that and will allow these funds to continue to be used to create that evolution of the healthcare system, right? So that you don't have some of the back and forth that we see with these transitions. And the key to that, I think, is bringing in the communities and the partners and the healthcare entities into the discussion from the beginning and into that structure. So it is not the state of Alaska, the Department of Health by itself standing up and saying, this is the vision, and that changes when there are changes in administration or leadership. But it's really saying, okay, we are seeking input. We want to make sure that your voice is part of our application. We want to make sure that as we move forward, you are part of these conversations. And one of the things that some of the conversations we've had with our stakeholders, we have said, this is a large opportunity and it's a lot of work. And in order for us as a state to be successful, like Department of Health, we're going to have to work differently with our partners and with our stakeholder organizations as we move forward. And we're going to need you to work differently with us. And I think we've tried to bring that mindset into this application from the very beginning, right? First state putting out a request for information so that we can get feedback on ideas Alaskans have. How do we incorporate that into the application? Now, how do we build that into the application process as we move forward? So I think that is how we've tried to care for it. So it's not dependent on a specific person or leadership position, but it's really a reflection of like the best subject matter experts in Alaska that we can bring together.
Yeah, and I would just build on that. I would say that, I see three buckets. The first one really hits on what Emily just said. One, this is a project for Alaskans by Alaskans. And so the sustainability will be dependent on Alaskans. We had over 1,000 people attend the webinar that happened today. We've had immense engagement. We encourage people to take a look at the website as well as CMS on what they've put out there and be engaged, because this legislative session, governor transitions, other elections, regardless, we are here as Alaskans looking out for each other, and that is one way that this will be sustainable. Two, both Emily and Heidi hit this, but efficiency. How many times have you entered your medication allergies when you've gone to things? How many times have you had to look up and get your labs and provide them over to a provider so that they can actually see what did that CT scan even show that they sent you in for? Being able to provide efficiencies within the system is sustainable in the ways that it decreases care in many ways. And third, I would just really highlight is the fact that much of insurance has moved towards thinking about prevention and value-based care. Everything from the way that managed care has worked, the way that Medicare and Medicaid are moving, many new opportunities coming out from CMS very rapidly are forcing people to think about how do we pay for these things sustainable and in the long run. And I think Alaska has had some real struggles with the large geography and small size to be able to take advantage of some of these opportunities. We just haven't had the infrastructure dollars, the soft infrastructure like on technology to help support that transition. And this is an opportunity for us to really lead. So I think that those three ways we can think about sustainability long term.
And I think one thing that I'd add finally is, and Eric, I think you mentioned this at the beginning where you said, coming out of COVID and dollars that flowed into the state during that time period, and then everybody kind of collectively went through, what does it look like when these dollars aren't here anymore? I think it's in that, it's not that far in the past. I think that, at the state and across the community and across Alaska, we all are acutely aware of what it can feel like and the reality that we can be faced with when you build programs and systems that are dependent on time limited dollars. And so I think that we're really approaching this from the beginning, from the state side, and then also from our partnership side, to say we really need to be thinking about how does this sustain, how are we using these dollars to build out systems and resources and opportunities that can flow into something that is self-sustaining when these dollars end, or that builds up the resources that you need to engage in the way that your organization operates a little bit differently.
Eric, I mean, just to bring it full circle, I think the difference between COVID and the Rural Health Transformation Program is we know there's a defined period and this funding is one time, right? So we've baked in the conversation of sustainability from day one. COVID was this evolution of funding, and you never knew when it was actually going to end, and sustainability was not a part of the conversation. And so I think that we are going to be in a position of better success because we truly have really focused in on Alaskan voices, creating the application, creating the initiatives, and I think Alaskans are going to carry this program through regardless of who is in the seat. Joe, that's a great question. What workforce initiatives are you looking at, and specifically specialists to stay in rural and areas? Emily or Betsy, you want to take that question?
Yeah, I think if we're talking about specialty services, I think part of what we want to look at with the Rural Health Transformation Program is what can be offered in more rural areas and what is available now and what are those challenges. And we've heard that workforce is is one of those challenges. And there's a couple of different reasons why or different challenges that we hear about when it comes to workforce and specialists in rural areas. Some of what we have written into the proposed funding initiatives actually come from ideas in rural regions where they've come to us and said, if we could try some different types of shift assignments, or if we can look at how to support specialists who may want to live and work in a rural area, but still need to be able to have more clinical time in other areas of the state, right? Like, how can we think about how our system is created right now and support them in coming up with ways to meet the challenges that they are facing? So those are some of the conversations we've had around that. I would also add, again, I think there's a technology component where we can think about how to leverage technology to expand how specialists are able to provide care in some rural areas in certain circumstances and what that looks like. So I'll pause there and see if Dr. Zink wants to add anything.
Go for it, Betsy. I saw you on mute and I'll go after.
Yeah.
Well, I was just going to say that, you know, I think that there's also a lot of opportunities to build out training programs for people who are Alaskan, who are from here, who are growing up here. And then to say, here are some entry level training opportunities to get to start that, you know, build the pipeline, grow our own space where we can ensure that we've got Alaskans taking care of Alaskans and working throughout rural Alaska. And then that opens up opportunities, I think, for other, you know, providers to practice in different areas and, you know, to be able to stretch and make sure that they're practicing how they need to be practicing in order to reach, you know, the upper limits of what they're capable of doing. But Dr. Zink, I think that you also have some really great perspective on this.
Yeah, I would just emphasize what was already kind of said. We know that we're not going to have a cardiovascular surgeon in every town in Alaska, but we need a network of services that no matter where you're at in Alaska or what sort of challenges you have an integrated system that allows your health challenges to be cared for. And so that includes subspecialty care being accessible in rural areas. That might be actually directly there. That might be telehealth. That might be a combination of services. But I also think that we are thinking carefully and deeply, and I just really have to commend the Department of Health for like their really in-depth way that they've been approaching this and engaging Alaskans across a whole spectrum to think about, you know, what is the way of a community health worker to making sure that someone's taking their meds on a regular basis? Do we have enough ultrasound techs to make sure that those additional services are being able to do? How about like doing, you know, that pacemaker monitoring to see what that looks like to be able to help support that cardiologist? So one of the common things I hear from subspecialists is that it's really hard to work in a place where you don't have the other subspecialty care with you to support the whole person care that you've been really trained to do. So how do we make sure that those services are integrated and that they are connected so that it makes it that subspecialists can practice and can be able to provide care no matter where Alaskans are at?
Okay, thank you so much, Rachel. Cassandra, do you have a question that you'd like to pose?
Desiree, that's a great question. The question is, has there been any specific initiatives for the region? I would say that we definitely that your region participated and responded to the request for information and gave a lot of great, submitted a lot of great ideas in addition to giving feedback on the application. And contributed to the 6 initiatives. I couldn't call out specific projects because I think, again, we were trying to accommodate and care for the entire state of Alaska and making sure that whatever specific projects each region needed, that it was built into the proposed funding uses within the initiatives. Emily or Betsy, do you remember anything specific that was raised?
I think some of it did have to do with access to specialized services and thinking really about maternity care specifically. So we did include kind of those ideas in the proposed funding initiatives. There's also a focus on some behavioral health needs that I think the region is working really hard to meet. So I just want to really thank that region as well for being so proactively engaged in the process as we develop the application.
So the question is, how will you work with the legislature to ensure they pass the laws needed to release the funding? And how much of the funds will be used before the necessary legislation passes? So Joe, the Department of Health went to, it's called LB&A, the Legislative Budget and Audit Committee, in November. And we presented the Rural Health Transformation Program and the budget that we submitted to CMS, the Centers for Medicare and Medicaid Services. And every state needed to submit a budget that was 200 million. And so that was our request, was federal authority so that the Department of Health could draw down those federal funds. And LB&A committee did give us the 200 million federal authority. So we're good there. We are going to go back when session starts and ask for the remaining balance. and I think we're going for 73 million, because it's 72 million and some change. So we'll be asking for the additional authority before Senate Finance and House Finance. So we're good to go.
Heidi, there was another question about how much will you spend before that authority? So that was the other second half of that.
Betsy, what are you thinking?
You know, I think that what we are working under is a tight timeline in order to obligate these funds. I think that for the first budget period, which we are currently in, we know how much money CMS has awarded to the state of Alaska for this budget period. And then we have until October of this year to determine how are we planning to spend those funds, how are we planning to allocate them. And then we will have another fiscal year following, so the second federal fiscal year, in order to finish spending this first budget period. As far as how quickly will we get the funds out the door, how quickly will we start to spend them, I think a lot of that truthfully will depend. We're working feverishly right now to stand up a process where external entities can apply for funds and describe their project to us so that we can take them in, take a look, make sure they align with the program goals and that they fit within the allowable uses of funds, work with our partners at the Centers for Medicare and Medicaid Services to kind of ensure that we're all aligned on the way that we're distributing these funds, and then get funds out into communities. So there's a lot of steps in what I just said, which was honestly a pretty simplified version of how this process will go. So I would love to say that I knew how many or how much the funds will be used on what timeline. But I would imagine it'll be within the next few months that we start to see funds flowing out the door.
Okay. Thank you very much. Eric, go ahead.
I was curious about sort of like inspiration. I was wondering if you guys had looked at other health systems that are accomplishing the goals that you guys are trying to accomplish especially well. Maybe with, and may not, obviously Alaska is Alaska. There's no other place like it. But these things sort of like data integration or some of the other things that you guys were talking about. Are there places from where you're drawing inspiration or other places that are doing this very well, like another country, another state, a private company? That's my question.
Great question, Eric. All of the above. It really depends if it's behavioral health to different value-based reimbursement models to primary care. And Emily, Betsy, I know we have looked at other models. We've participated in conversations, but can't draw any into the top of my mind.
Yeah, I'm happy to chime in. I think that looking through each of those 5 buckets, there is inspiration across the country. So if you look at Healthy Beginnings, some amazing work happening out of Mississippi and other places and looking at how do you really get preventative services? How do you integrate services in rural health? What's happening in those things? The state legislation had passed previous work on congenital syphilis to try to address this. The state also passed extended Medicaid to be able to help to address maternal health issues. The state's taken on some of these issues in the past in numerous ways, but I think all states are looking at the rural transformation, but then how do you fit into that? So that would be like in that category. Thinking about healthy communities, I think there's always a lot of conversation in Alaska about what happens in like the Oregon model of CCOs. How do you make sure that voices of community are brought up and raised into the way that insurance modeling and base happens? But a lot of these things don't fit perfectly for Alaska, and we've got to figure out what the right balance is. The way that we do maternal health care in this state, particularly, having families come closer to a delivery center is very unique here. Having the way that we have tribal community health aides is very unique, but provides really amazing, outstanding care. So I think it's this balance between looking at other places, but not losing the greatness of what Alaska has and figuring out how to incorporate those things as a whole. I think from a technology standpoint, this is where there's a lot of efficiencies that can happen really closely and easily. We all use our phone. We don't have an Alaska phone versus a, a Mississippi phone. Like we have a phone, but we use it the ways that we want to. And so I think that there's a lot of standardization that can happen. I think when we think about data and technology, really thinking about how do we enter information once, but use it multiple times? How do we make sure that it's very patient centric, that information is for the benefit and the health and well-being of people? And then how do we make sure that population health data is publicly available so that communities, governments, others can help to be able to navigate, to think about what that community looks like and needs, and is able to respond? Because otherwise we're flying blind in our ways that we're able to transform healthcare. So I think there's a lot more examples from a data perspective that can, and the technology perspective, where we can really lean on what's happening in the lower 48 and other states that could be very applicable here.
Eric, I would add the lower 48 is really looking to Alaska because, when solutions are created in Alaska, like the community health aid program, which is a great example, or the dental health aid program, or behavioral health, it very much can apply to the lower 48. And so I think they're looking to us as the leaders in how to change rural healthcare delivery. And we're really leaning into that innovation. And I know we've said this before, but truly, the ideas have come from Alaskans, and I think they all are gathering their ideas from various different places. As Anna was talking, I was thinking of traditional healing. That was a specific ask from the tribal health organizations, and we wrote that into the application.
I would just
Emily?
also add,
Oh, yeah.
yeah, and then Emily, I would just, we talk about like rural health and how this is really an Alaskan project, but also like not only if it works for rural Alaska, will it work for Alaska, but it will also work for urban areas as well. I don't think any of us love to sit in a doctor's appointment for 45 minutes or 3 hours waiting for an appointment that we could do, on our lunch break between other things via, our phone in a different way. So there is a place for in-person care where we are going to have to drive and we're going to have to meet our procedures. But I think that there is also a real way in everyday's busy life. I don't think we take into account enough the physical burden and the time burden of our inefficient healthcare system has on people's everyday life. And I think that we have an opportunity to not only think about value in terms of what services we pay for, but how do we make that the services we're paying for more valuable to people so that it fits within their busy life. They're able to take ownership of prevention. They're able to take ownership of their health, and they're being able to navigate the system and really direct their own healthcare rather than it being this complex, blind, frustrating system to work within.
Yeah. So Eric, you just asked a great question, because now we're just going to popcorn and just all answer. But it is fascinating to learn about the future of healthcare and technology and all of the different solutions that are out there that are really directed to you as a person, right? You can get over-the-counter testing as an example, and that's continuing to expand the different types of tests for various different types of diseases. I think wearables, a lot of Americans are wearing a lot of wearables, and that technology in the wearables are expanding pretty significantly and rapidly. And so I was in a conversation, and it was really presented that we're on the cusp of this significant transformation with technology and how it is helping the average person, because the technology is going to identify disease early. And so our healthcare system is really about triaging that early identification and engagement so that we can, whatever the needs are for that individual, it's met early on. And so I think, again, this merging of how we as Alaskans are adopting technology is really going to change the way healthcare is delivered.
Okay.
I'll just jump in with what I think is a pretty quick question. Dr. Zink, can you describe your role?
Yeah, practicing physician in Matsu, and currently helping with the state when asked. So just yeah, they said, hey, can you come to this meeting brief today? Finding ways to think about how to serve Alaskans has always been the heart of my job. And while I do a series of things right now, including working the ED and do consulting work and work part-time at Yale, my heart is in Alaska. And when the Department of Health asked if I could help, I said, sure.
I think one thing that you'll see as we move forward is that we have so many subject matter experts in Alaska with deep experience and deep knowledge. And again, as we think about what this means for the future of Alaska's healthcare system, we need everyone to bring that subject matter expertise and that knowledge into all of the work that we are doing. And so again, when we think about how can the department work differently with our partners, with our providers, with our stakeholders, we are going to have new, some of the voices that we have in these maybe quiet meetings, we're going to bring them together to share in these public meetings, because again, this is for all Alaskans, right? And so we need to make sure that we are bringing in those subject matter experts. And so I think as we move forward, you'll increasingly see voices sitting alongside the Department of Health talking about what this means from their perspective with the healthcare system.
Thank you. As we're winding down on time, does anyone have maybe one more question?
I have an unlimited number of questions. But
I
the
suspected
last
that.
one, the last one for right now, I guess, is like just following up on Joe's earlier question about authority. Like, is all the decision making for this program centralized in the executive branch? Do you guys need, like, does the legislature have an opportunity to change how any of this funding is used? Or is their role basically like approve X amount in federal receipt authority, and that's sort of the end of their involvement?
Eric, that's a great question. So the executive branch is executing the federal grant, just like any other federal grant that we receive, right? The only difference is this is a large amount of funding, but think of the Department of Transportation as an example. They receive large federal grants. They, as an executive branch, that's their role to execute the deliverables of that federal grant. But the legislature does have a role. The executive branch goes and presents and asks for federal authority. So we did that outside of budgets, session cycle. We're going to have to go ask for more authority. There's also policy considerations. And again, this was a competitive grant that was, we were competing with the other states. And so what we heard from Alaskans was to be competitive, and part of that competitiveness was the technical scoring around some of these policies. So there is legislation that will need to pass, and that's the role of the legislature, to have those conversations around the 5 different types of compact licensing that's in the application, and the expanded scope of practice for pharmacists.
Well, thank you guys very much for organizing this. I really appreciate the opportunity to chat with you guys about this. This is something I had a lot of questions about, and yeah, so thank you for making yourselves available.
You're welcome, Eric.
All right. Thank you so much. Do we want to just touch quickly on kind of next steps, what we're looking to accomplish tomorrow and Friday? Just kind of give them a little preview, and then we'll wrap it up.
Yeah, thanks, Shirley. So we're calling them convenings, and we're going to do just a spotlight and a focus in one area of the rural health transformation, so that all of us can really gain insight into one area. So tomorrow, Thursday and Friday, is the kickoff, partially just like really ensuring that all Alaskans are aware of this opportunity. What is the grant? What are the goals? What are the initiatives? Answer those questions. But we're going to be doing a deep dive into technology. So that's going to be Thursday and Friday. We do plan to do more convenings around various different topics around the rural health transformation over the course of year one, and then definitely again regularly throughout the following years. So tomorrow, Thursday, and Friday will be at the Hilton, and we'll be focusing in on the future of healthcare and technology.
Okay, thank you so much, Commissioner Hedberg, and everyone else. I really appreciate taking the time to speak with all of our media partners today. Have a
Great, thank
great
you, guys.
afternoon.
Take care. Bye-bye.